So we have folate here, which is going to be our ambulance, okay? Folate is converted to its active form through MTHFR. Now, most people have the typical form of MTHFR, which is going to be our PUA here. But some people, maybe somewhere between 20 and 30%, have a mutated MTHFR. That's going to be our little piggy on wheels. Okay. So the job is for the MTHFR to take the folate and bring it over here to our FR alpha, which is our charger from Rebel and Crew, of course. And when it takes it here, now charger can take the ambulance to the brain. We're able to do so because the FR alpha here is able to cross the blood-brain barrier. Now, if we have the mutated form of the MTHFR, our piggy on wheels, then we can no longer use charger here or our FR alpha to get the folate to the brain. Sorry, charger. What happens is we have these antibodies here, which are no good, and the antibodies stop the transport to the brain. So in these cases, you will have folate showing up in the blood, but the folate is not actually available to the brain because of these guys. Then what happens is we have these two over here. We have duck on wheels, who is our homocysteine, which we don't want too much of. And we have our methionine here, which is mini. And the homocysteine is supposed to be transformed into methionine. And this basically messes up what goes on in the mitochondria in the cells and affects the DNA and RNA. And this can all happen in utero. This can happen while a mother is pregnant with her child. We also know that folate, our ambulance here, is necessary for appropriate development in the brain in terms of where the cells go, which cells are kept, which cells are disposed of. So this is about efficiency of communication in the brain. So when you're born, you have lots and lots of brain cells, and over time, they're supposed to get rid of the ones that you don't seem to need and keep the ones that you do. For children with autism, when we look at research studies from the past in terms of their neuroanatomy, they tend to have too much of everything. So they have some of the good stuff, and they have a lot of the things that they don't need in the brain. Essentially, the brain has trouble cleaning house. All right, now let's talk about how this affects the gut or the stomach and intestines. So when you have this mutated MTHFR, this causes disruption to the gut because it affects the way that B12 is absorbed because of these antibodies. Additionally, there's some research to support that if there's not enough B12, then there can be too much homocysteine. We have an atypical MTHFR with antibodies. No good. People with autism are more likely to have mutated variants of the MTHFR enzyme, and they're also found to have increased levels of homocysteine and reduced levels of B12 that we need in the body. Bluey says, take your B12. In fact, the research has supported a strong relationship between Fragile X and Rett syndrome, which is two big genetic mutations that are responsible for autism. And this is because these antibodies, Mr. Dino Truck here, get in the way of absorbing folate. Now, if you've heard of the FRAT test, this is out of SUNY Downstate in New York. And this test for these guys, we're looking for, do we have these antibodies? So we know kind of what's blocking the folate from being absorbed and blocking it from crossing over into the brain from the blood. We also know that there's other ways to get folate into the body, even if we have these antibodies and this mutated MTHFR. So what do? Well, one theory is that folinic acid, so that's going to be our little astronaut here, folinic acid. This is able to cross the blood-brain barrier because of RFC. It's suspected that Moana here can only work in the presence of folinic acid, this specific form of the B vitamin. It's also been shown that in some cases the cow's milk here can trigger the antibodies and prevent the gut from absorbing folate through RFC. Research has shown that this folinic acid or leucovorin has resulted in increased verbal communication and decreased repetitive behavioral patterns. However, we still need to be cautious because this is largely evaluated through questionnaires and subjective measures. The efficacy rates of folinic acid per the research has ranged anywhere from 0% through 88%, depending on the population and the particular study. Additionally, there have been some adverse effects to the leucovorin. However, these are mostly things that tend to overlap with autism as a whole, like insomnia, aggression, GI distress. So we're still not sure what the optimal dose may be per child because they have these variabilities in their gut and in their diet. We have to understand, do they have a mutated form of the MTHFR? Do they have the FR alpha antibody? And are they in a country where food is fortified with B6, which is the inactive form of folate? So all in all, there is some promise in the area of folinic acid or leucovorin. However, the research shows that it is most effective when taken with B12, specifically the methylcobalamin form of B12. There might be benefit from removing cow's milk from the diet if there's concerns about absorption in the gut. It's definitely a good idea to do the FRAT test to test for the FR alpha antibodies. It's a good idea to consider genetic testing to see if there's a mutated form of the MTHFR enzyme and ensure that they can be absorbed from the blood into the brain. Also, before you do anything, change any diet, take any vitamin or supplement, or consider doing anything different as far as your child's medical care, please make sure that you speak to a doctor.